So we will continue with cognitive behavioral therapy, but the focus, the last four session was the focus on addiction, right? So today the focus is a different disease, which is depression. And every session I will talk a little bit of about the disease itself, the same we did with addiction. So for today we just cover the symptoms of depression. I'm sure most of you are aware of the symptom of depression. Okay, and this is according to DSM, Diagnostic and Statistical Manual, which is a Bible for mental health and psychiatry. It has a list of all the symptom of and the classification and the categorization of mental problems. So anyway, for symptoms of depression, it is 9 symptoms. If you have 5 out of the 9, this increase the suspicion for a clinical depression. However, to diagnose a depression, this needs training. It is not just reading the symptoms and then you diagnose yourself with depression and then you set plan for the treatment. It needs lots of experience to plan to put a treatment plan for depression and to know if it is clinical depression or just a reaction to life situations. So according to the DSM, the symptoms are depressed mood, which feeling sad, feeling empty or tearful. This is one of the symptoms. In kids, when kids get depression, they have different. Sometimes they have depressed mood, but most of the time it become as restlessness or irritability. The second symptom is loss of interest. You feel no interest in doing stuff that was previously pleasurable. So you no longer like to talk to people. If you like to go online, you don't like to go online on social media. You don't like to play music. You don't like to go to practice the sports you like. So you lost interest loss of interest in different things. These are the main symptoms. So to diagnose a depression, you need one of these. This has to be one of the symptom of depression, depressed mood or loss of interest. Then another one is a change in appetite, increase in appetite or decrease in appetite. Both, I'm sure you notice people who, when they get depressed, they eat more. Other people, they eat less. So change in appetite is one of the symptoms. Change also of sleep, increase sleep or decrease sleep. Both are symptoms. And the people who have less sleep because of depression, sometimes it is inability to initiate the sleep. Sometimes it is interrupted sleep. They go to sleep easily, but they wake up multiple times. And sometimes they wake up earlier than they used to. And sometimes they sleep more. Okay. Another one is a change in behavior and the movement. Some people will become restless, irritable, and start pacing and restlessness. Some people will become more slow in thinking and slow even in movement, and sometimes the extreme of slowness or slow movement, we call it catatonia, where they become like a statue. Another common symptom is fatigue and the loss of energy. Mental fatigue and physical fatigue. Feeling of worthlessness and guilt and hopelessness and helplessness. These are common feelings with nobody can help me, I can't help myself, there is no hope in life. Decrease in concentration and focus is one of them. The last one is recurrent thoughts of death or suicide and sometimes suicide attempts. So these are the symptoms. Okay, if you have few of these symptoms, this increase the probability that this is a clinical depression. Okay, we will focus in the next 4 sessions on how we treat it, how to treat depression using the CBT model. One of the main technique is something we call behavioral activation, which I told you with depression, you have depressed mood, okay? And then you have less energy. So you lost interest, you have depressed mood, you have no energy, so you don't want to do anything. And you feel like you lost 90% of your energy and you have only 10% left. So you decide not to do anything because you say, okay, I'm gonna use this 10% of energy that is left, maybe to cook some food, maybe go to the washroom, maybe the maximum take a shower, and that's it, because I don't want to do more than that because I feel I'm losing all my energy. The treatment is opposite to all of what I said. We want you to force yourself to do stuff and to get up and keep moving. So you need to activate yourself despite how you feel. Next session we will talk how to change your thoughts, how to change your feeling. And CBT means you work on thoughts, feeling, and also behavior. So I'm starting with the behavior, like you need to do something even you have depression, even if you feel you feel like not doing anything. Okay, how are we gonna do that? Like, of course, within limits. I don't want to force someone who is almost catatonic, he can't even move, okay, to do stuff. So there is limits on where to use the behavioral activation. But for people who are working with, and the patient we are working with within a family practice, this technique can work for them. They need to start doing stuff. Okay, what stuff should I do? So we need two skills or two tools. We need to monitor what they are doing already, and then schedule for the activities or the positive activities that we are doing. So see how much activities they are doing, and if it is positive or negative, is it healthy or unhealthy, is it helping with the depression or worsening the depression, and then try to make some observation and then try to reschedule a positive activities. Okay, give you example. This is a guy who have depression. Okay, you ask them, okay, can we monitor or can we examine your activities yesterday? And then we for this specific guy, you ask them, okay, what did you do? They tell you, okay, at 11 I get out of bed, 11:30 I took was my breakfast, then from 12 to 3 I was watching TV and on Facebook. At 3 p.m. I went to do some shopping. At 4 p.m. I took a nap for 1.5 hours. At 5:30 I started playing video games. And then I started 3 hours playing video games. 8:30 I ate chips. 9 p.m. he realized that he didn't do anything physically, so he started to run on treadmill for 2 hours at 9 p.m. Then 11 p.m. he lay in bed for an hour. He couldn't sleep, so at 12 a.m. started watching TV, and then he slept at 1:30 a.m. So you look at this, and then you try to identify what is unhealthy and what we need to change. So for this guy, there wasn't a healthy breakfast. He was playing on Facebook and watching TV a lot. That he exercised, did physical exercise, but it was at 9 p.m. and we don't want to do that. It's gonna affect your sleep. That's why he couldn't sleep. Okay, if you look, he didn't talk to any human being. Like, he didn't talk to a family member or a friend or anyone. So this you make observation about how much activities they are doing, and then you try to change them. Maybe this guy, he need to move treadmill to morning time. Maybe we need to eat more like breakfast to be more healthy. He also need to talk to someone, call a friend, or go for a walk, at least a 15 minutes with someone. Okay, and practice sleep hygiene. Practice sleep hygiene. And if they need sleeping pills, it is okay to take sleeping pills. Listen to music, take a shower before bed. This will help with sleep, and we know sleep affect mental health. So you see, these are the observation. So we start scheduling the activities again, but more in a more healthier way. So this is an important. So examine, if you are working, examine one of your working days, examine one of your weekend, and see what are the changes you need to do. Okay. Sometimes for people who have depression, you ask them, okay, we need to do some healthy stuff. How are we gonna do them? What we should do? They don't know, and they don't know what they shouldn't and what they should do. So you need to, when you work with depression or you have struggle with the depressive symptom, you need to include activities that have three of this stuff. You need activities that improve sense of mastery, and you need activities that induce pleasure, and you need activities that give meaning. So research have shown when you work on these three areas, this is going to improve the depressive symptom. So mastery mean achievement or performance. And these are the things that we work on today for the exercise. Okay, you will try to identify in your current situation what are the activities for performance, what are the activities for pleasure, what are the activities that gonna give meaning. So mastery, as I mentioned, mastery, what does it mean? Means achievement or performance or accomplishment. Because when you feel you accomplish something, you give yourself a credit, it improves your mood. This is the way it works on with depression. Achieving something, it can be business, it could be school, it could be household chores, it could be so many things. So I put a list of things here, but you don't have to choose from them. You can generate your own things that give you sense or feeling of mastery. So doing your laundry, mowing the lawn, cleaning your car, buying and selling stocks for people who work on stocks, planning for starting a new career, going to work, paying bills, volunteering. Those are different ideas to give you a sense or a feeling of achievement. Okay, so in your situation, I want you to create a to-do list or achievement or performance list. Not for today, like for tomorrow, for example. Tell me things that you think you could achieve, and try to choose things that are realistic. Okay, don't put unrealistic goals because it's gonna cause more depression. So tell me, for example, for tomorrow, tell me 5 things that you have to achieve, and you're gonna give yourself a credit for achieving them. Okay, so this is one area that everyone, and ongoing, I want you, before going to bed, prepare for the things you gonna achieve tomorrow, and prepare for the things, or create a list of things that gonna bring pleasure tomorrow, and prepare for things that gonna bring meaning or have a meaning or give you a meaningful life for tomorrow. This is a treatment for depression, also prevention of depression. Okay, so we created a list of achievement. We want to create a list of things that give pleasure, because we know with depression there is anhedonia. Anhedonia means loss of pleasure. Okay, so we want some stuff to induce pleasure, even if you feel it will not bring pleasure, but you can recall stuff that you were doing in the past and start doing them again. It's gonna induce the pleasure. So these are examples, but you can come up with ideas that can work for you. Reading, some people being outdoors, listening to music, trying a new AA meeting, going to a new church, attending a sport event, going for a walk, dancing, going to the gym, going for a drive, praying, going swimming, riding a bike, drinking a cup of coffee, different things, getting a massage. So different activities that can bring pleasure. The goal here is not achievement, not performance, it's just to feel good. Okay? So one of the exercises, you're gonna tell me what are pleasurable events that you usually enjoy. Okay, meaning. In the past was religion and the faith was giving meaning to people, but now lots of people are staying away from religion and the faith. So you need to find a meaning, because if you can't find the meaning in life, you look life as a source of suffering. So you'll find the suicide, nihilism and loss of meaning, and then sometimes it's gonna end up with suicidal thoughts. So we need to identify meaning, or know a meaning in life. So for some people, the meaning is a relationship, a family, a partner, like a certain relationship. Some people will a cause or a political movement, or helping the homeless, or volunteering at animal shelter. Like try to identify a cause that give you meaning in life. Okay, so it is for some people still religion is the source of meaning. To attend the church, to read the Bible, to do help the poor, like these are help gives them meaning in life. So anyway, you will need to identify the most meaningful areas of life for you. For example, this guy or this lady, faith, family, education. These are the meaningful area in her life. Okay, then what are the actions that she's gonna take to work on these areas? So maybe for her family, she's gonna go and help her aunt. Maybe for a church or a faith, she's gonna sing in a choir and pray. Maybe for education, she working on her master's, she's gonna study for her exam. So you see what gives them meaning in life. It's good to write them down, and then for lots of you already have a meaning and you already work on them. Subconsciously, you are not choosing the meaning in life, you just do it. But it is good every now and then to prioritize what are the things that are important for you, and to see if what you do is what you value. What you do is what you value. Okay, try to balance and match both what you say and what you do and what you believe in. Try to connect these dots. This will help with prevention of depression. Anyway, for the exercise, you're gonna tell me, this is another exercise. We have 3 exercises today. One of them is to tell me what are the most meaningful areas of your life, and what are the actions or steps that you will take to work on these areas. Okay, so this is one exercise. What is the most meaningful area in your life? How you gonna, what the action you're gonna do to feel that you are working toward what gives you meaning in life. Okay, this is one exercise. Another exercise, what are the pleasurable events or pleasurable things that you enjoy in life? Give me a list. It doesn't have to be 10, like give me at least 5. Okay, another exercise, to-do list. This is about just achievement. Some stuff you need to achieve. You can talk about next week, you can talk about next day, whatever make it easier for you. Let's do it tomorrow. I'm gonna do 1, 2, 3, 4, and if I do these 5 things, I will feel that I accomplished something. Okay, for the sake of time, you don't have to do the 3. Let's choose 2 that you're gonna share with each other. So, but again, for depression, there is low energy, there is depressed mood, there is loss of interest. We're gonna talk about how to fix these thoughts and feeling and negative feeling next session. But today I want to work differently from another area. It's just to do something. Okay, if you read the Canadian guideline for treating depression, you will find that exercise, just exercise. If you're gonna go on treadmill every day for an hour, okay, just doing this is antidepressant. This can be helping people have mild to moderate depression without taking antidepressant. If you have I'm talking about someone with clinical depression, it's not interested in taking antidepressant. If you can activate yourself, push yourself to do aerobic or cardio exercise like a treadmill for 1 hour 5 times a week, this has antidepressant effect similar to the antidepressant. You see? So when you force yourself to do something, it's gonna help. What I wanna do now is we wanna force or push yourself to do stuff related to achievement, stuff related to pleasure, stuff. And the other thing is that is related to meaning. So you create a list of things that you're gonna do tomorrow. You tell me about a few things that give pleasure in life for you, and tell me about what gives the meaning. I like to you do the, so I told you the 3 exercises, choose 2 of them. I would love to see all of you working in this one specifically, because lack of meaning in life in general can cause mental illness. So I try to identify 3 meaning, and we will learn from each other. Sometimes a meaning, something give meaning to someone, I can copy them and use this as a source for meaning for me in my life. So tell me meaning here, and then tell me what you do to work